Throughout the semester, we have identified 4 areas containing potential barriers to our health education program. Therefore, I will discuss how to overcome those barriers. 1. Lack of access to clean water. Poor hygiene and inadequate access to clean water made the poor vulnerable to STH infections. International organizations such as Uganda Village Project donate and install wells in rural areas. However, even when people have access to water from a well, there are risks of contamination due to different factors such as lack of sanitation and education. Many people believe that as long as they are getting water from a well, it is clean water. Oftentimes, they put quantity over quality. Therefore, our health education program will teach children how to keep water sources clean and free of contamination, the importance of collecting water from clean water sources, even if it means to walk a longer distance. Also, we will teach them about the danger of infections and diseases contracted by drinking contaminated water. 2. Inadequate sanitation. STH infections are transmitted by eggs that are passed in the feces of infected people. Therefore, without proper sanitation infrastructure, will be very hard to decrease the number of people infected with soil transmitted helminth. In places with high rates of STH infections, people do not have access to latrines, or the number of latrines in the village do not satisfy people's needs. Uganda Village Project is dedicated to increase latrines coverage in rural areas. However, toilets are not enough if there is no hygiene promotion to get whole communities to change the habit of generations and use the toilets. Our health education program will complement the project by educating people and providing information on how to avoid contamination and infections by using latrines and avoiding the use of untreated human feces as fertilizers. Number 3. Unwillingness to take deworming drugs. There are studies showing that the main barrier to seeking STH treatment is not availability or cost of the drugs, but rather the lack of motivation to seek for the drugs. A study made in Africa found that many members of rural areas believe that STH are critical to one's health. For example, some people said that worms are essential for proper digestion. Other people said that deworming medications interfere with people's fertility. We will form teams of high school and university students to educate parents about the health benefits of deworming programs, answer questions, and clear up any misconception regarding deworming medications. Each team will work in one neighborhood of the village, going house to house educating parents. 4. Misconceptions about transmission. Many times, people are not aware that soil transmitted helminth infections can be prevented by doing simple things such as washing their hands. We are going to install tippy taps near latrines at the schools to encourage children to adopt good personal hygiene habits, such as washing their hands. Tippy taps are simple devices for hand washing. This was our presentation. Thank you for watching.